I have the advantage as a scientist that I get to focus. So the only thing that I study, I often comment when I do seminars and events like this, that in my world there are two kinds of bacterial pathogen. There is Staphylococcus aureus, and there's a contaminant. If it isn't Staph aureus, I don't study it. So that is the reason for my participation. I think most of you probably know that one of the leading problems today in bacterial infection and the consequence of antibiotic resistance is in Staph aureus infections, the so-called MRSA, methicillin-resistant Staph aureus. So while I do focus, I would like to think that I focus on an important problem. So that's what my laboratory does at UAMS. I do teach medical students. I teach sophomore medical students, so I guess my job is to try to get them to Dr. Cicente's residency with some background. And I trust that he won't, if he does have a conflict with that, he'll keep it to himself. And I guess
at least in this forum.
At least in this forum, right. No, I teach medical students, and one of the points that I make, and I enjoy it very much, but one of the points I make is that antibiotic resistance is absolutely inevitable. And that's what makes it so important that we be prudent in our use of antibiotics. That includes all fronts. And we can talk about what some of those specific issues are and what you can do, but it's fundamentally important that we be as prudent as we can be in our use of antibiotics, the way we take them, the way we prescribe them, and all these sorts of things, because if we don't, we're going to end up in exactly the situation that we're currently in, where physicians are trying to keep healthy patients who have serious disease, and their ability to do that is being increasingly compromised. And I think that's one of the most important points in all of medicine. Certainly, there are many, many things that we need to be concerned about. I certainly hope that we ultimately find a cure for cancer, but I think it's fair to say that there's no medical specialty where our advances in what we can do is not currently being severely compromised by infectious disease and antibiotic resistance. So I think it's an issue that needs to be dealt with, and that's why I agreed to come tonight.